This achievement involved a 4-pair chain transplant among 4 sets of patients who were incompatible, basically because of ABO, or what you call a blood group incompatibility, or antibodies incompatibilities. Or in simpler terms, none of them had a donor who could have donated a kidney to them successfully. With experience, meticulous planning, and the use of virtual cross-matching technique, the team skillfully matched each recipient with a suitable patient or a suitable donor so that they could be transplanted successfully and come off dialysis and lead a productive and healthy life. Often at events like this, we focus mainly on surgery and their spectacular outcome. And culturally, there is sometimes a belief that outsiders can do it better than our own. Today, I proudly sit here to say that these surgeries were performed entirely by the doctors and staff of the Georgetown Public Hospital Corporation.
I would also like to encourage people, if you have a friend, a family that is in kidney failure, to please donate. You wouldn't die, you're saving a life. You would be, as Dr. Kishore said, you would be one of the healthiest person walking around this place, because you would be visiting the doctor often, you would be doing your tests, so you would be one of the most healthiest person walking around.
Being on dialysis isn't something easy. It drains you a lot. And I can tell you proudly that I'm happy to be a kidney transplant recipient, because my life improved a whole lot better. Now, my first transplant from 2015 lasted approximately 9 years and change. And it failed, and I was back on dialysis for approximately 1.5 years. And then I got a donor, but my donor didn't match. So that was heartbreaking, because being a second-time transplant patient, it wasn't easy, and it's difficult finding a donor to match me due to some antibodies and other technical stuff. And when Dr. Kishore Prasad came and he explained to me about chain transplant, I had hope again. I had hope that I'm going to live a comfortable and perfect life, because I did got married just before my kidney failed second time, and I have a child. So it was kind of down on me, and I was kind of processing what life would be with me on dialysis, being married, and having a kid. So when Dr. Kishore Prasad explained to me about chain transplant, and there were 4 recipients and 4 donors, and we're going to exchange the donors and get a transplant done, I was happy. I could see the light at the end of the tunnel once more.
My initial recipient was supposed to be my mom, as the doctors explained that we weren't a perfect match. All right, my kidney was better suited for someone else. Maybe if it went into her body, it may have failed, since she has antibodies that might fight against the kidney. All right, I still went through with the kidney transplant because I trusted the doctors. All right, Dr. Kishore especially is very, very reassuring. All right, my whole time there that I spent in the ward, a few days we spent basically bonding as we prepare ourselves for the operation. The donors and the recipients, we became like friends. Some may even say family. All right, because it's just us there in a room for weeks.
I think there are lots of good things that we have seen from this program, but again, they're the trendsetters, they're the pioneers in the Caribbean, and they're the leaders, I would say now, in the Caribbean. And we want to keep it that way, and I think with these new additions that we are doing, Guyana would continue to be at the forefront of transplant. So once again, I want to congratulate the team here at the Georgetown Hospital, and to the patients and the donors, To the donors, we are very happy that you had the confidence of coming forward to assist the patients who needed these kidneys. And you can see from the way that they have been talking and how proud they are of getting these kidneys. And it can return them to a life of normalcy. When you're on dialysis, it's very problematic, and you know, they can have pretty much a normal life. So they value this donation that you have given to them. And I'm sure, as the patients would have said, this here is another lease on life. Make sure you use it wisely.